Good evening, guys. This is Dr. Paul. Once again, thank you very much for tuning this evening to listen to this video. And today I want to talk a few minutes about bulimia nervosa. Bulimia nervosa is a very common eating disorder. Before I go further, some of you have asked me which book is the best book for USMLE clinical skills examination. I recommend USMLE Smasher. This is USMLE Smasher, and this is what I studied. This is excellent book, just $19, and many of you waste thousands of dollars on attending expensive courses, but I recommend USMLE Smasher and get this. And this is the book I recommend for clinical skills examination. Also visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where we have posted hundreds of videos which will be very helpful if you go through them on a daily basis. Now let me talk a few minutes about bulimia nervosa. First, the social phenomenon. You see, one of the most disliked words in our culture is discipline, self-discipline. We have so much lack of self-discipline when it comes to alcohol. We have been seeing binge drinking, and the result is alcohol-related disorders have been widespread. We have been seeing lack of self-discipline in sex. We are seeing an explosion of sexually transmitted disease in our culture. And the same with the smoking, lack of self-discipline. Smokers are causing like $35 billion loss to the healthcare industry. Now coming to this problem, overeating problem, that is the basic feature for bulimia nervosa. There is a lack of control in eating. But to be specific, let me give you the DSM-4 criteria as the essentials of diagnosis. First of all, in this disease, number one, there is eating in discrete periods of time. Patient chooses like 2 hours, and in those 2 hours he or she eats like extraordinary amounts of food, like 2, 3, 4, 5 times the regular people eat. That is the kind of excessive eating is the characteristic feature in this disease. Secondly, a sense of lack of control. I mean, they cannot stop eating. They eat and eat and eat and eat, and they never feel that they should stop because there is no control on their decisions. And next, there will be a inappropriate compensatory behavior. Patients, they go to the restroom and they induce vomiting with their fingers, and they take laxatives, they take diuretics, they give enemas themselves. So there will be inappropriate compensatory response to this problem. And when it comes to the time period, this inappropriate behavior should be at least twice a week for 3 months. That is one of the criteria to diagnose bulimia nervosa. That is twice a week for 3 months. Now, what are the specific types? There are 2 types. Number one, purging type. Number 2, non-purging type. The names themselves, they explain what they are. Purging type is bulimia nervosa characterized by purging. Like patient takes some laxatives, or he self-induces vomiting, or he takes enemas. So those kinds of things happen in purging type. In a non-purging type, patient does not use these purging methods, but he or she will do fasting. He or she will go to the gym and exercise for hours and hours and hours together. So purging and non-purging type, those are the 2 basic types of bulimia nervosa. Now, treatment. When it comes to treatment, you have to decide whether to admit the patient or not to admit the patient. What are the criteria to admit this patient? If the patient has severe electrolyte abnormalities, number one, you should admit them. For example, if they have hypokalemia, like potassium level like 2 or 1.5, in those circumstances you should admit them immediately and correct those electrolyte disturbances. Number 2, when these patients have depression, severe depression and suicidal or homicidal tendencies, you should admit them. Number 3, when the outpatient treatment is unresponsive, you should admit them. So those are the 3 criteria for admission, but most of these patients can be managed on outpatient basis. Now, exact treatment: number 1, behavioral therapy; number 2, supportive therapy; number 3, nutritional therapy; number 4, pharmacological therapy. Let's go one by one. Number one is behavioral therapy. I want to give you a few behavioral therapies that are very, very effective in bulimia nervosa patients. In fact, many studies have shown them to be effective. On the top of the list is cognitive behavioral therapy, CBT, and IPT. IPT stands for interpersonal therapy and also the group therapy. So these 3 therapies are useful for bulimia nervosa patients. So try those 3 behavioral therapies and see for the response. Then the second thing is supportive therapy. For example, if there are organizations like Wow Raters Anonymous, just like we have Narcotics Anonymous or Alcoholics Anonymous or Smokers Anonymous, we have Wow Raters Anonymous. Just recommend this patient to join in the local Wow Raters Anonymous, where they can get help on how to regulate their food intake. And thirdly, the nutritional counseling. Many of these patients don't have an idea how to regulate or get a balance between what they eat and how many calories they should take. So these patients do well if you refer them to a nutritional counseling expert, where they get enough information about how to eat and what exact amounts of calories they should take. So the thirdly, it is nutritional counseling. So number 1, it is behavioral therapy; number 2, supportive therapy; number 3, nutritional counseling; number 4 is pharmacology. Antidepressants of any group, either tricyclics, monoamine oxidase inhibitors, or trazodone, they all help in reducing bulimic episodes, even if in the absence of depression. So try antidepressants like SSRIs are good, tricyclic, monoamine oxidase inhibitors, or trazodone. And secondly, among SSRIs, the most important point is fluoxetine. Fluoxetine is the only medication approved by FDA for the use in bulimia patients. That's a very, very important point, and you should remember that. Fluoxetine is the only medication approved by FDA for use in bulimia patients. That's an SSRI, selective serotonin reuptake inhibitor. And the other points are bupropion. Bupropion is contraindicated in patients with bulimia because there is a higher incidence of seizures, there is a higher incidence of convulsions in these patients. That's why you should not use bupropion in these patients. So those are the main medications: antidepressants, SSRIs, and also you can try ondansetron. It's a 5-HT3 receptor inhibitor to control the vomitings, and it also reduces the amount of bulimia in these patients. So those are the things. And finally, always think of complications. These patients are excessively at the risk for metabolic acidosis, metabolic alkalosis, hypokalemia, cardiomyopathy, dental infections, and loss of enamel in the tooth, and abrasions in the skin, that is called Russell's sign, and fatigue, weakness, suicide. So always you should try to make an eye on their complications. So that's about bulimia nervosa, basically the treatment and diagnosis and the pathogenesis. Thank you very much. As always, visit us at www.usmlevideos.net And this is Dr. Paul. Thank you very much.